Hi, our family construct was family information keeper, and we chose to review the medical power of attorney as a subtopic. The medical power of attorney is an individual who has been designated and given the necessary medical and personal information to make an informed decision that supports the wishes of the designee. It was researched why and in what situation someone would choose a medical power of attorney and how nurses view the subject. We reviewed different literature, and we found that nurses educated to advance directives and information regarding medical power of attorney were more likely to discuss the topic with families that would benefit from it. If the attitudes were positive regarding advance directives, but many still felt uncomfortable discussing with a patient due to inadequate knowledge and resources. We also found that individuals who had been diagnosed with Alzheimer's disease are more likely to select a proxy and engage in conversations about their future care. When a neurological illness is considered, a power of attorney is often chosen to handle the finances, healthcare decisions, and estate.
The medical power of attorney is an early step in advanced care planning. This planning requires careful consideration of the patient's own beliefs, values, and goals for treatment and outcomes. We reviewed a study that made it clear that as healthcare providers, one of our responsibilities is to educate our population on why advance directives are important and useful and are not just for the aging population or someone with a chronic illness. The studies showed that patients, especially those who had a neurological disease, were more likely to choose a power of attorney than healthy adults. And even though individuals with chronic illness or neurological diseases were much more likely to have a medical power of attorney, it was only around half of that population that had one. So the other half had little or no decisions for their future medical preferences if they became incompetent. And we picked a graphic that explains that patients with chronic illness were much more likely to have advance directives.
Under the recommendations for nursing practice, we found that a nurse should establish a relationship with the power of attorney as well as the patient, because once the patient can no longer make the decisions, the responsibilities fall onto the medical power of attorney. We also found that nurses should explore their own feelings regarding power of attorney in order to assist patients and not be biased. A few questions for consideration we had were: how often are medical power of attorneys used and needed? Is it necessary to have one? Is there a difference between a power of attorney and a medical power of attorney? And should a living will that a patient signs trump the power of attorney if the decisions were opposed? Then we have our references, and that concludes our presentation on Family Information Keeper.